Back to class. I hope তোমরা সবাই খুব healthy আছো. So we are going to discuss some of the PYQs from your Olympiad examination. Every question that has ever been asked in your NSO examination সেগুলোকে আমরা আজকে এখানে discuss করব. So without any further delay, I hope you all are ready for this session and I would like to ask you all to call your friends as well. সবাই মিলে পড়াশোনা করলে তাহলে আরো বেশি ভালো হয়, right? So welcome back everyone. Let's discuss the very first question. প্রথম questionটা তোমাদের NSO থেকে and this was asked in the year 2020 to 2023 and the question is it's a statement based question. The first question asked was each smooth muscle fiber is long, spindle shaped, tapering and uninucleate. So if I have to write all these words and draw them here, this is what they means, that every smooth muscle fiber is long. So you can see they are long, they are spindle shaped. So this is called as spindle shape because both ends are fused. So both ends are fused here, both ends are fused. That's what we call it as a spindle shape and can also be called as tapered, right? So both the ends are fused here and followed by uninucleate because you can see a single nucleus. You can see a single nucleus here. That's why they are calling it as uninucleate. Now, so the statement 1 is absolutely correct. This is what a smooth muscle fiber looks like. Okay. Followed by smooth muscle fiber shows transverse striation and occur in the wall of tubular organ. No, this particular thing is wrong, absolutely wrong. They are called as smooth muscles because there are no striations. There are no striations. You won't see any long, dark or light bands at all. They are completely smooth. If you talk about the skeletal muscle fiber, if I'm talking about a skeletal muscle here, skeletal muscle fiber, they have striations. So you can see that they have these kind of striations such as some dark light bands present here. You can see some light bands as well present here. So that would be the property of smooth skeletal muscle, not smooth muscle. So of course this is wrong. These are called as the striations, the dark and light band striations. They are not present in smooth muscle. That's why this statement is wrong. Yes, they are found in tubular organs, but because of this particular word, that makes the entire sentence wrong. Okay. So of course both the statements correct. No, statement 1 is true, but statement 2 true is false. 2 is false here. So option number C is going to be the right answer. I hope you understood this question. This was asked in the year 2020 to 2023. Moving on to the next question, and that is, so this is an image based question, and please remember image based questions are very, very important. Image based questions are quite important. So the first question that was asked here based on an image, that epithelium X covers the ovaries. So something that covers the ovaries are usually called as germinal epithelium. Germinal epithelium because they are in future going to form the gamete. Remember, germinal epithelium, they are called as germinal because they are going to germinate the gametes. In case of ovary, they are going to, of course, in case of ovary, they are going to form the oocyte, okay, or in ovum as well. And in case of the testis, they are in future going to form the spermatozoa or sperms. So that's what they mean here, that the epithelium X covers the ovaries and lines the sperm producing tubules. Sperm producing tubules means they are talking about seminiferous tubules. Seminiferous tubules. Okay, so seminiferous tubules and ovaries, they are both lined by germinal epithelium, and germinal epithelium here, they look somewhat like this, cuboidal in shape. Okay, germinal epithelium have cuboidal in shape, cube shape, square shape. So which of the following diagram looks like this? Of course this one. This is a cuboidal shape structure. So I would say that A is going to be the right answer. If you look at B is quite elongated. This is columnar. this is columnar shape, right? So if you look at C, they are also columnar, but they have cilia. So they are ciliated columnar. Ciliated columnar. And if you look at D, they are quite tightly packed cells and very thin cell, and they are called as the squamous cells. So they are the squamous ones. So we have seen all of them, but A is going to be the right answer because they are found in the ovaries and also in the lining, lines the sperm producing tubules called as seminiferous tubules here. Moving on to the next question, question number 3, everyone. Question number 3 that they have asked again in the year 2022 to 2023, and it is asked as a, okay, so you have to find out the incorrect match. Which of the following is incorrect here? So let's see the incorrect one. Polio is caused by a virus. Absolutely right. The polio is caused by polio virus. Okay, polio virus is a type of enterovirus. It is a type of enterovirus, and enteroviruses are what? They live in the intestine, they live in your gut. So polio virus always enters in your body through food, through contaminated food and water, right? And of course they live and thrive in your gut epithelium or in the alimentary canal. So this polio virus is absolutely right. Athlete's foot are caused by fungus. Yes, it is a fungal disease. Athlete's foot is also caused by the fungus named as trichophyton, epidermophyton, etc. Epidermophyton. These are epidermophyton. So epidermophyton, trichophyton, then microsporum. These are the fungi which causes athlete's foot. And because it causes a fungal infection in your skin, athlete's foot is sometimes also called as tinea pedis. Pedis means here the foot, because it is causing a skin infection, a fungal disease in your skin. Okay, that's why it is called as tinea pedis, because it's of your foot. If it is in the scalp, I would call it as tinea cruris. If it is in the groin region, etc. Okay, sorry, tinea cauda. So here these are all dermatophyte type of fungi. Okay, because they are causing skin infection, skin fungal disease. All right, moving on to, so of course this is also right. Chicken's leg. No, this is wrong. Chicken leg is not caused by a bacteria. No, chicken leg caused by herpes virus in chicken. Sometimes it is also caused by reovirus. Okay, so reovirus or the herpes virus can cause chicken leg, especially this causes chicken leg. Okay, and this causes a viral arthritis in the chicken. So of course this combination doesn't make sense. This is incorrect. But yes, if they would have given you chicken foot, that would have been a bacterial disease. Okay, that would have been correct. But they have given what? They have given chicken leg. So this is incorrect. We have finally found our answer, that is option C. But still, let's read option D as well. They have given tetanus. Tetanus is caused by a bacterium which is called as Clostridium tetani. Clostridium tetani is the bacterium that causes the disease tetanus. It is a bacterial one. Moving on to the next. Hello beta, hello, welcome back. Abriti has joined. Welcome back, Abriti. So we are discussing the Olympiad questions as promised, all the previous year Olympiad question that was ever asked in your NSO examination. Moving on to the fourth question. I hope you can answer. This is one of the very favorite topic of my students, and that is the control and coordination chapter, the neural control and coordination chapter. So here you can see that they have provided a diagram of a neuron here, right? So they have asked identify X, Y and Z. So you can see X provided here. This is X, here is Y and here is Z. So we would write all the names first. That would help us. So X is obviously the cyton. It is the or the cell body. Y are the dendrites. They are the dendrites. and Z or Z, they are nothing but the axon. So they are talking about axon here. Let's try to match them up now. They are asking X is a cell body. Yes, X is a cell body. Having nucleus and cytoplasm. Yes. You are supposed to find out the incorrect one, not the correct. This is a correct statement, right? B, option number B says that Y is a dendrite. Yes, which are branched extension of the cell body. Absolutely right. Because the dendrites, they are called as neurites. Axon are also called as neurites. They are coming out of the cyton. Axon is always a single extension and the dendrites are multiple in number. It may be one, but in this case it is multiple. This is also right. Z is an axon, which is cylindrical process arising from X. Yes, Z is an axon arising from the cell body, that is X. This is also correct. Y transmit nerve impulse from one neuron to the another, whereas Z receives the impulse. No, this is wrong. If so, I have found my answer anyway, but let's see here. The function of dendrite is that they would always, the dendrite, if this is a neuron here, if this is a neuron here, let's imagine that this is the axon and these are the dendrites. Okay, the job of dendrites are to receive the impulse. It receives impulse. Okay, receives impulse, and they would make sure that the impulse comes to the cyton. And the job of axon, this is axon, and the job of axon is to transmit the impulse to the next neuron. It transmits the impulse to the next neuron. So this is how from one neuron to the next neuron it is transmitted like this. So of course C is going to be incorrect here, right? You guys can also participate here. Please participate and try to answer along with me. Moving on to question number 5 now. Another image-based question has been asked. So image-based questions are an integral part of an SO examination or any Olympiad examination, especially we are talking about biology questions. So what they have asked here is, which of the following epithelial tissue lines the duct, column and urinary tubules? So any duct, or most of the time the column and the ducts of your glands, etc., they are always lined by cuboidal epithelium, right? So the one that is cube shape, okay? And urinary tubule here means we are talking about the nephron. They are talking about nephron. So in case of nephron tubules, especially the proximal convoluted tubule, the distal convoluted tubule, the collecting duct, these are all lined by cuboidal epithelium, all of them. So duct as well as the tubules, nephron tubules, the PCT, the DCT, the collecting duct. Loop of Henle, only the thick part, not the thin part. So what would be the right answer here? Of course, A would be the right answer to this question. I hope you understood this. Now moving on to the next question. So we have already found the answer to this question. Option number A would be the right answer. Moving on to the next question now. Next question again, if this particular question was asked in the year 2021 to 2022, and the question reads like, read the given statement and select the option that correctly identifies them as true and false ones. So let's read it out. Quinine or quinine is an anti-malarial drug obtained from bark of cinchona tree. Yes, this is correct. This quinine is actually an alkaloid. Okay, quinine is an alkaloid. Okay, it is a type of secondary metabolite which is again extracted from cinchona tree. This cinchona tree is very native to South America. This is found in South America. And do you know that this quinine drug is very much useful for the malignant type of malaria, the most dangerous type of malaria? See, there are different types of malaria that we suffer from. So there is the normal one which is called as the benign malaria caused by Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, etc. But Plasmodium falciparum, this treats Plasmodium falciparum. It treats the malaria, called as the malignant malaria, malignant or quartan malaria, malignant malaria. And this particular malaria is the most dangerous one, which is caused by what? Caused by the Plasmodium falciparum. Plasmodium falciparum. This is the most dangerous species of malarial parasite, falciparum. All right. So quinine is very much helpful in this. Okay. Who has answered? Sanglap has answered. Good job, Sanglap. You have, let's see whether you have answered correctly or not. By the way, this is true. Let's see now. Tuberculosis causing organism enters via nose. Yes. Tuberculosis is mostly, passed from one person to the other person through droplet infection. Okay, through droplet infection, through inhalation, through aerosol, etc. Somebody who is infected with tuberculosis, if that person sneezes or coughs or drink from a cup and you are using the same cup, so in this way it can pass from one person to the other person. Okay, so yes, via nose, but usually reside in the pancreas. No, this is wrong. Tuberculosis may go to the pancreas, but most of the time they reside in the lungs. It's a respiratory disorder. Later it may invade other tissue of the body, but this thing is wrong. They would reside in the lungs. They reside in the lungs. So this is false. True option, statement number 2 is false here. Okay. Yes, Sanglap is asking, ma'am, that is the question number 5. This is question number 6. Okay, for A you are saying 5. Okay, I got it, Sanglap. Moving on, let's try to answer question number 6 now. Okay, HIV virus upon entering the human body spreads to all lymph nodes. Yes, right. Because lymph nodes are where all the differentiated T lymphocytes are waiting for it. But the HIV, when they reach the lymph node, they go to the lymph node because they are in lookout for those cells which are CD4 receptor. So in the lymph node, if I have to write here, please remember that in the lymph node, okay, in the lymph nodes, there are cells with CD4 receptor. CD4 receptors are present. Who are the cells with CD4 receptor? T lymphocyte and macrophages. T lymphocytes and macrophages, they are waiting. So HIV virus would always bind to those cells which has the CD4 receptor, not to any other cell. All right, that's why they go to the lymph node. All right, so this is true. This one is true here. Virus causing hepatitis damage the liver cell, resulting in jaundice. Yes, because the cells are getting damaged because of this hepatitis B virus. Hepatitis B is caused by hepatitis B virus. This virus, because it attacks the liver cell, it goes to the liver cell. Those infected liver cells are now attacked by your antibodies, by your body's own immune system. So gradually what would happen? One by one, most of the liver cell will die, isn't it? My body's police would try to catch the thief, and the thief is already living inside the liver cell called as hepatocyte. So the police would come and they have now recognized that, okay, these liver cells are already infected. I have to kill or attack these liver cells. So gradually one by one, your liver cell would get damaged. What would happen? If the liver cells are damaged, will the liver be able to do its normal function? No, right? So that's what happened. Liver is unable to process bilirubin. So bilirubin amount would increase in your body, resulting in jaundice. So this is absolutely right. So this is true. So true, false, true, 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 false, true, true. Option number 3 is going to be the correct answer here. Okay, option number 3, Sanglap has answered correctly. Good job, Sanglap. Moving on to the next question now, everybody. Question number 7. What is the function of part labeled as X? So you can see here in this diagram, there is a part that is labeled as X. They are asking what is the function of that X part. So let's see here. This is the diagram of a fallopian tube. And this particular fallopian tube, X is nothing but the fallopian tube structure, and fallopian tube are also called as oviduct. Also called as oviduct. This is the place where when the ovary releases an oocyte, the oocyte enters into the oviduct, and inside the oviduct or fallopian tube, it waits for a spermatozoa to come. So if the spermatozoa that has entered comes through here, it would fertilize the oocyte over here. That is the job of fallopian tube. Simultaneously, the female gamete, that is the secondary oocyte, and the male gamete, that is the spermatozoa, would meet in the fallopian tube, and that is where the fertilization takes place. So let's see here. It produces ovum when a female reaches puberty. No, that is the job of ovary. That is the job of ovary. Ovary would do it, right? Ovary would do it. Why would ovary would do that function? Production of gamete. It carries ovum and zygote is formed here. Absolutely right. Because of fertilization, zygote is formed. Remember, zygote is the product of fusion of, it is the product of fusion of male and female gamete. Male and female gamete would fuse to give you a zygote, right? So this is absolutely correct. So option number B is going to be the right answer for question number 7. Rest of you, please try to answer, okay? This is very easy. It normally serves as the site for implantation of embryo. No, site for implantation of embryo would be the uterus. Uterus is where the implantation occurs. This is the uterus. This is where you would see implantation. Here the implantation occurs in the uterus. Okay, implantation. It is the place where development of embryo takes place. No, that would also be uterus. Right? So we already found our answer. Option number B. Sanglap is the only one who is answering. I need answer from all of you. Abriti, you also try to answer. Moving on to the next question. Question number 8 now. Study the following table and select the correct option for P, Q, R, S and T. Okay, let's see here. They are saying measles, that is the disease, causative agent P. So measles is a viral disease. It is a viral disease caused by virus. The name of the virus is either rubella or rubeola. Rubella is causing German measles and the normal measles is caused by rubeola virus. Okay, now it is mode of transmission air, yes, droplet infection, aerosol infection, etc. Droplet or aerosol infection. Okay, then Q, bacterial, water and food. So let's see here. Q would be, P is virus. So we have found P virus, P virus, P virus. Now Q has to be bacterial. So hepatitis is not a virus disease, bacterial disease. It's a virus disease, virus causing disease. So this can't be. Now let's see Q, cholera. Yes, cholera can be an answer. Cholera is a bacterial disease caused by Vibrio cholerae. Cholera is caused by Vibrio cholerae. Followed by typhoid. Yes, typhoid is also a bacterial disease caused by Salmonella typhimurium. That is also correct. So there could be 2 of these could be the option. Of course, first can't be. B, of course, can't be an answer. Let's see here. Now Q, dengue is causative agent. So dengue is caused by, again, here it is caused by a virus. It is caused by a virus. The name of the virus is arbovirus or dengue virus. Okay. Then S, mode of transmission, mosquito. It's a vector-borne disease. Vector-borne disease caused by a female mosquito. Which mosquito is this? Female Aedes mosquito. Female Aedes mosquito would carry this disease, and if an infected female Aedes bites you, you would also get that infection. You will also suffer from dengue. All right. Now, yes, who has answered here? Knight has answered 8 questions. C is the right answer. All right. Okay, virus. So yes, so far we have found the answer now. Now malaria. Malaria is a protozoan disease. So S is mosquito and T is a protozoa. It is caused by a protozoa and name of that protozoa is Plasmodium. Name of that protozoa is Plasmodium vivax in most of the cases. Right? So we have found the answer, that is option number C. Good job everyone. Moving on to the next question. Question number 9. refer to the given Venn diagram. There is a Venn diagram that is given here. Venn diagram means when such overlapping shapes are used as a visual tool. So this is a visual tool for you where they are using these overlapping diagrams. Now they are asking find the correct one. So caused by bacteria and communicable disease. Among these, which is the bacterial? Anthrax is the bacterial, because anthrax is caused by Bacillus anthracis. It is caused by Bacillus anthracis. Okay, so Bacillus anthracis is a bacteria. So we already know this is going to be the right answer, because it is a bacterial disease, and of course communicable, can be passed from one person, infected person, to another person. Okay, followed by this communicable disease was caused by a virus. So yes, dengue is caused by a virus. We just studied that dengue is caused by arbovirus. Okay, so yes, this is going to be the right answer, option number B here. Good job everyone. Moving on to the next question. Again, there is another Venn diagram given here. So in this Venn diagram, you have to find out tuberculosis as X and AIDS as Y can be placed at which alphabets respectively. So please remember that tuberculosis is a bacterial disease first of all. Okay, so bacterial disease. So let's see which of the following is showing this bacterial disease. None of them. But yes, this could be a chronic disease. Tuberculosis could be a chronic disease here. Right? Okay, so it is a chronic disease. Chronic disease means from a very long time, long lasting, a long effect, from a long time it is present here. So it could be U. It is not viral, so can't be P, can't be T, can't be R, can't be U, can't be S, because it is not sexually transmitted. All right, so this is your U. So U, among them only one of them is with U, so we know A is going to be the right answer. But still, let me explain the rest of the options as well. So they are saying here AIDS. AIDS is a viral disease. It is a viral disease. It is an STD, right? And of course, it is also your communicable disease. It can pass from one person to other person through the sexual contact or blood transfusion, etc. Direct contact here. All right. So yes, 9, you're saying B. Who is saying B? 9, Sanglap. Yes, Sanglap, you're absolutely correct for 9. Okay, so AIDS is V, and we see here V comes between a viral disease and a sexually transmitted disease. This is V. So Y is going to be V here. If you want a detailed study of this, please remember that P starts here, the P1. If you look at the diagram, this is P, and P is viral disease only. Viral disease. It is only representing viral disease. If you look at T, T is representing what? Viral disease and also chronic. It is a viral disease. Okay, it's a viral disease plus it is chronic. Okay, chronic. Now followed by, look at U. U is only chronic disease. Okay, it is only chronic disease. Followed by, if you look at what else? R. R is only STD, sexually transmitted disease only. If you look at what else is remaining, P, T, U, R is done. If you look at S, S is a sexually transmitted disease plus it is also a chronic disease. A chronic disease, because S is between this circle, sexually transmitted disease circle, this one here, if you look, right, and U is between in this particular cycle. Okay, S comes in both the cycles, sexually transmitted and also chronic disease, S. Followed by, if I have to write for the V, V comes between two circles here. So if you look at the V, V comes within the sexually transmitted and also this viral disease and also chronic, all the three. So if I have to write for V, V is chronic plus it is viral plus it is STD, all the three. It comes under all the three. Then lastly, if I have to talk about Q, Q comes under, what are the circles that Q comes under? Q comes under sexually transmitted and viral disease. So Q would be viral plus sexually transmitted, viral plus STD. All right. Is it clear to all of you? Those who do not understand the Venn diagram, this is how the Venn diagram suggests. Okay, fine. So you have answered, Sanglap has answered, 10 is a good job, Sanglap. Moving on to the next question, question number 11. Let's see what 11 means here. They are saying read the statement and select the correct one. So you have to find out the correct answer here. All right. Acute disease persists for a long time, hence cause prolonged ill health. Wrong. Acute here means short term, short term, short term and severe, very severe. Okay, and it is usually can be treated, usually can be treated if it is caught early and if the treatment is provided properly. So it can be treated. All right. So this statement is wrong. This is for the chronic. This is what chronic means. Okay, chronic. Followed by acquired diseases are physiological abnormalities present since birth. No, wrong. That would be the innate diseases or congenital diseases. Congenital diseases. Okay, followed by cleft palate is caused due to environmental factor. Yes, if the pregnant mother is affected with any kind of teratogenic agent, such as the mother is taking some kind of medicine, okay, and that medicine can cause some deformities in the child, and the child would be born with a palate that is not completely closed. That is what is called as cleft palate. Our palate, that is the part which you can touch with your tongue. If you try to touch your roof of the buccal cavity with your tongue, you would see the palate, you would feel the palate. This palate is made up of two bones, and both the bones usually form differently as a two different bones, and they fuses till the time we develop properly and till the time we are born. But if it doesn't fuses, then there is a gap that you can see. This is called as the cleft palate. Okay, cleft palate. So cleft palate can be due to environmental effect, that is called as teratogen. Teratogen or teratogenic factor, and there could be some genetic factor as well. Some genetic factor can also affect it. Cleft palate. Okay, just give me one moment. Okay, followed by hemophilia. Hemophilia is a genetic disorder, a gene mutation. Absolutely correct. It is caused by X-linked recessive gene. Okay, X-linked recessive gene mutation. All right, so X-linked recessive gene mutation would cause hemophilia in your body. So yes, that is gene mutation. This is right. This statement is right. Let's see why this is not, this one is wrong. AIDS and German measles cannot be transferred. No, it can be transferred from the mother, infected mother, to the baby. This kind of transfer, where you would see these diseases are passing from an infected mother to the child or to the baby, this kind of infection would be called as vertical infection or vertical transmission. Okay, vertical transmission from the mother, infected mother, to the baby. All right, moving on to the next question. 11C you have answered correct. Good job, Sanglaf. Moving on to the next question, question number 12. So here they are asking match the column 1 with column 2 and select the correct option from the given codes. Okay, so 1A they have given. A looks like what? A, you would see here the nucleus looks like an headphone, isn't it? Looks like an headset. So this kind of what do you say, nucleus is mostly seen in case of eosinophil or acidophil. So eosinophil's job is nothing but to provide allergic response. This is allergic response. Okay, allergic response. So A is going to be 3. A is going to be 3 here. So there is only one option with 3. So D is going to be the right answer. But still we would see rest of the options here. B, if you can see, look at B, B has no granules. They are agranulocyte. You can't see any granules present in the what? In the cytoplasm. So of course this is an agranulocyte. Agranulocyte. And this agranulocyte is nothing but a You can say this is a monocyte. This is a monocyte, quite a large cell. It's a monocyte. And the function of monocyte is phagocytosis. This is phagocytosis. Phagocytosis. I know this thing that have been written is quite small for you to visualize. So I am writing it here. It is, your B is 1. Okay, phagocytosis, followed by, of course, this structure that you see. The last one is the structure of basophil. This is the structure of basophil, and basophil is a granulocyte. Both eosinophil and basophils are granulocyte. You can see small granules present in the cytoplasm. These granules are the ones that take up the stain, and because of the staining property, they are either called as a basophil, which takes the basic stain, also called as acidophil or eosinophil because they take the acidic stain. All right. So of course, the option C would be 2 because they helps in releasing heparin. Releasing heparin. They secretes heparin, which is an anticoagulating agent. So 2 B1 C2 A3 B1 C2. We already found the answer. Let's see, 12D Sanglap has answered correctly. Moving on to the next question, question number 13. Refer to the given table of differences between cartilage and bone and select the incorrect differences. Let's see, cartilage, it is a soft, elastic and flexible. Absolutely right. Yes, cartilages are soft, they are elastic because they are flexible, they are, bendable. Followed by bone, it is hard, tough and non-flexible. Yes, they are non-pliable. Absolutely correct. Non-pliable means they can't be bent so easily. So this is right. It is a matrix, occurs in homogeneous matrix. Yes, its matrix are present in something like this. If you look into the structure of a cartilage, this is how the matrix is present, completely evenly distributed all over the matrix, and their cells are present inside these lacunae, these spaces. And here its matrix occurs in lamellae. Lamellae means layers. Yes, this is also correct. In case of bones, you would see that their matrix are actually present in these layer by layer by layer, layer by layer by layer, etc. So these are concentric circles present in the bone. Each of these lamellae contains small spaces where the osteocytes are located. So this is also correct. Tissue has rich supply of blood. No, wrong. They are avascular. If you look into the structure of a cartilage, they are avascular. Avascular. If you look into the bones, they are highly vascular. They have a rich supply of blood. So this sentence is wrong. Okay. Followed by growth is bidirectional. No, their growth is unidirectional. They have only perichondrium. Unidirectional growth is supporting only because there is presence of perichondrium. Only one side. Okay. Perichondrium only. But in case of bone, it is bidirectional. Bidirectional growth can be seen, and bidirectional growth is because of, again, presence of both periosteum and endosteum. Both are present. Endosteum, right? So we have seen this in the class as well. Why perichondrium, why periosteum and endosteum are helping in bidirectional growth. From both sides the growth happens. So perichondrium is present around the matrix. So this is the matrix of the cartilage. Here you would see the presence of the perichondrium. Okay. But in case of bones, you would see, if this is the bone here, let's imagine that this is the bone. All right, this is the bone. Somewhere here the periosteum is present, and here the endosteum is present. Okay, endosteum, and this is periosteum. Between this, the matrix is present. This is the matrix. All right, and this is the bone marrow cavity where the bone marrow is present. So the bone is showing bidirectional growth from both sides, but cartilage only has perichondrium, not endochondrium. So they would show only by once unidirectional growth. So this is also wrong. 3 and 4 are wrong. So this is going to be the right answer. Option number B. 13, option number B is correct. Knight has answered correctly. Sanglap, you made a little mistake, but no worries, good that you have tried. They are asking us to find the incorrect difference. You might have misread and answered the correct ones, right? Okay, chalo. Moving on to the next question. Identify the type of muscular tissue from the given figure and select the correct statement. So this particular figure, that is X is representing what? It is representing the skeletal muscle. It is representing the skeletal muscle. But if I talk about Y is representing the cardiac muscle. Cardiac muscle. Why so? Look at the diagram. The skeletal muscle here, you can see striations. You can see dark and light band. Striations can be seen here, right? In a single fiber, you can see multiple nucleus as well. This is multinucleated. This is a single fiber. This one is a single fiber, and a single fiber you can see multiple nuclei are present, correct? Okay, so these are some of the features would suggest that this X is a skeletal muscle. But if you look at Y, you can see branching. You can see branching present here. So branching or branches are only present in cardiac muscle. Second, you can see presence of intercalated disc. Intercalated discs are also present only in cardiac muscle, only in cardiac muscle, right? So cells of X are uninucleate. Is it correct? No. X are multinucleate. So this is wrong. A is wrong. Followed by X is voluntary. Yes, X is voluntary, whereas Y is involuntary in nature. Absolutely right, because skeletal muscle is innervated by central nervous system most of the time, or controlled by central nervous system indirectly or directly. So central nervous system is under your own control. If I want to contract my bicep, I would do so. If I don't want to, I won't do it, because it is not under my will, correct? So in case of, it is under my will. That's why I can relax it. I'm so sorry. Followed by cardiac muscle, if you talk about, they are innervated by autonomic nervous system. Autonomic nervous system is not under my willpower. So it is involuntary in nature. So B is absolutely right. Let's read C. X is mainly found in alimentary canal. No, X is mainly found in skeleton. They are skeletal muscles, so they are associated with the skeleton wherever the bones are present. Blood vessels, whereas X are mainly found in the limbs. No, your Y is mainly found in the heart. That's why it is called as cardiac muscle. This is wrong. Both X and Y show slow contraction. Absolutely wrong. X and Y can't show slow contraction. X shows fast contraction. They contract faster contraction. That's why they get fatigued very, very easily. All right, because quicker contraction would consume more and more O2 faster. So more and more O2 is depleted. Now there would be anaerobic respiration taking place, which result into lactic acid accumulation, and that's what result into this cramping and fatigue. But followed by the Y would never get fatigue. So they would show, rhythmic contraction, rhythmic continuous contraction, rhythmic and continuous contraction, but they never get fatigued because of refractory period, never get fatigued. All right. So this is the right answer, option number B. Moving on to the next question. Yes, okay. You want me to explain intercalated again? Okay, no worries. I would explain intercalated. Look here, if I just add a page and explain you what intercalated disc means. Look here. Let's imagine that this is my cardiac muscle fiber. Okay, cardiac muscle fiber. This is a single fiber, and you can see this branching present as well. Okay, the branchings are also present. Okay, like this is my cardiac muscle fiber. Now this is a single fiber. This is one single fiber with a single nucleus. This is another fiber with another nucleus. This is another fiber, another nucleus, another fiber, and so on. Okay, this one is called as an intercalated disc. This is called as an intercalated disc, which joins one muscle fiber to the next muscle fiber. Okay, intercalated disc, what does it do? It connects or joins or connects one muscle fiber to the next. Now look here what they are actually doing by connecting them. If you look closely into the intercalated disc, I am going to take a small cut here and would like to show you what exactly the intercalated disc look like. Okay, this is what it looks like. You have one muscle fiber. Okay, this is one single muscle fiber. Okay, and you would see another muscle fiber present right beside it. Another muscle fiber present right beside it. I am showing you the ultrastructure of this part. So intercalated disc has this gap junctions. The gap junctions are connecting adjacent muscle fiber. This is one muscle fiber, this is the next muscle fiber. This is one muscle fiber and this is the adjacent muscle fiber. Okay, so what are they doing? They're connecting both the adjacent muscle fiber with the help of this gap junction. Okay, this is called as the gap junction, one of the part of intercalated disc. I am telling you what intercalated discs are made of. So one thing is this gap junction. What would the gap junction do? They would allow the impulses traveling from one muscle fiber to the next muscle fiber. So what are they doing? They are just transporting the impulses or material or the electrolytes from one muscle fiber to the next muscle fiber. This is how your entire heart can contract as a single unit, na? Especially both the atria, both the ventricle contract at the same time. How do they do so? If the impulse is generated at the SA node, which is located on the right atrium upper corner, but left atrium has nothing to do. Left atrium has no SA node, nothing. How are they also contracting at the same time? So SA node, which has generated the impulse, it is passing that impulse to the left atrium from one muscle to next muscle to next muscle to next muscle like a chain. And this is how they are contracting. So gap junction is helping in this, that transmit from one muscle fiber to the next. Followed by the next thing that you would see in a cardiac muscle fiber in intercalated disc is this. This is called as the adhering junction. This is the adhering junction. So you would also see adhering junctions or desmosomes. Desmosomes. What are they doing? They are attaching one muscle fiber to the next. So one muscle fiber attaches to the next one tightly. These junction would cement two cells, adjacent cells together, called as the adhering junctions, also named as desmosomes. Desmosomes. All right, I hope you understood this night. This was your question. You wanted me to explain intercalated disc. Is it clear? Should we move then? We are moving to the next question, question number 15 now. Question number 15 suggests identify the tissue X. Here is tissue X given. Tissue X actually is nothing but your adipose tissue. This is an adipose tissue. How would I know so? Because if you look into one of the cells, these are nothing but the fat storing cells called as adipocyte. Adipocyte. The adipocyte looks somewhat like this, with a nucleus at one end and a large vacuole, and a large vacuole like this. This is the fat storing vacuole. This is the fat storing vacuole. All right, fat storing vacuole. And this is the adipocyte. This is the adipocyte. So tissue X stores fat and insulate body against heat loss. Absolutely correct. We found the answer. Tissue X fixes skin with the muscle. No, that is the job of areolar tissue. That is the job of areolar tissue. All right, areolar tissue. Followed by tissue X serves to bind the bones together. No, that would be the job of ligament. That would be the job of ligament. Tissue X connects skeletal muscle with bone. No, that would be the job of tendon. Tendon. So we already found the answer, option number A. Good job. Yes, 15A night you have answered correctly. Moving on to the next question. Match column 1 with column 2 and select the correct option from the given codes. So here it is given that squamous epithelium. Where would you find squamous epithelium? The squamous epithelium, the thinnest type of epithelium, can be found in blood vessel. So 3, blood vessel, can be found in alveoli of the lungs. So here it is 7, I guess. 7. Oh, right. So 3 and 7 are with two options here. Let's see. Ciliated. Ciliated can be found in, so ciliated columnar, this is how they look like, with a lots of cilia. The tall slender cell can be found in fallopian tube 1, and can also be found in windpipe, where they are supposed to move objects, they are supposed to move air, they are supposed to move mucus. correct? Followed by cuboidal epithelium. Cuboidal epithelium looks like a cube shape, a square shape cell. You would find them in thyroid gland and pancreatic duct. So it is 5 and 6. 5 and 6. So we found it 1, 4, 5, 6. Option D is going to be the right answer. As they are saying columnar epithelium. So you would find columnar epithelium, the simple columnar epithelium can be found in case of course, there would be microvilli as well present, brush bordered in your stomach and in your small intestine. So it would be seen in 3. It would be seen in 3. Stomach and small intestine is 8 here. 8. Okay. So 3, 7. 2, 4, 1, 4, 5, 6 and 3, 8. So 3, 8, not 3, 8, it is 2, 8, not 3, 8. I am so sorry. It is 2, 8. 2, 8. Okay, 2, 8. So we found the answer already. Option number D is going to be the correct answer. Good job. Moving on to the next question, question number 17. Let's see what is going to be the right answer for this question. Refer to the given Venn diagram once again. An overlapping visual tool is presented to you. So let's see, select the correct statement regarding it caused by a protozoa. So P is caused by a protozoa and also a communicable disease. That means it can be passed from one person to other person. So protozoa could be caused by bite of testis fly. Testis fly can cause sleeping sickness, trypanosomiasis. But sleeping sickness, this trypanosomiasis is a protozoan disease. P could be a protozoan disease, correct? Whereas Q is caused by Vibrio cholerae. No, Q is a virus they are saying. No? Vibrio cholerae is a bacterium. It is a bacterium. So this can't be an answer. Now, P could be characterized by uncontrolled cell division. No, they are saying specifically it is a protozoal disease. Uncontrolled cell division means cancer. Right? Cancer is not caused by any type of pathogen. It is genetic, it is carcinogenic. Genetic mutation, genetic change takes place. Okay, so wrong here. P could be African sleeping sickness. So yes, African sleeping sickness can be caused by a protozoa, whereas Q is a Kala Azar. No, Kala Azar or Kala Azar is a protozoan disease, not a viral disease. So Q can't be protozoal. Wrong. So P could be malaria. Yes, malaria is a protozoan disease. Okay, is communicable, can be transmitted from one infected person to the next healthy person through a bite of a female Anopheles mosquito. It is caused by a protozoa called as Plasmodium vivax. Absolutely correct. Q here they are saying is a dengue. Yes, dengue is a viral disease. So D is going to be the correct answer. Moving on to the next question. 17 is D. You have answered correctly. Knight, good job. Moving on to the next question. Study the given table carefully and select the option that correctly fills the blank. Disease here. We have mumps. Mumps is a disease caused by rubella. Rubella. So rubella is given where? Among them only here. So of course this is going to be the right answer. But still, let's see the rest of the options as well. Elephantiasis is caused by Wuchereria bancrofti. Wuchereria bancrofti is an Askelminth. Wuchereria bancrofti is an Askelminth here. Okay, bancrofti is an Askelminth. R here they are saying Bacillus anthracis causes anthrax. We have anthrax. Okay, so we have found the answer already. Ringworm can be caused by epidermophyton, can be caused by trichophyton, can be caused by microsporum as well. Epidermophyton. So we already found the answer. Moving on to the next question, question number 19. Select the correct match of the deficiency disease and related nutrient. So they are saying that vitamin E causes scurvy. That is wrong. Scurvy is not caused by vitamin E. Scurvy is caused by deficiency of vitamin C or ascorbic acid. Ascorbic acid. Followed by iodine, marasmus. No, marasmus is caused by your calorie deficit. Calorie deficiency. Calorie deficiency means deficiency of all the energy producing biomolecules such as carbohydrate, such as protein, such as fats, etc. All of them. And if they ask you about kwashiorkor, then kwashiorkor is again a protein deficiency only. Marasmus, deficiency of all the nutrient, that is carbohydrate, fat, proteins, etc. But if I talk about kwashiorkor is only protein deficiency. Followed by protein killosis. No, this is again wrong. If you talk about killosis is, it is kind of a skin disease, especially around the lips. There is drying of the lip area, inflammation of the skin around the lip, and that is caused due to deficiency of vitamin B6. Vitamin B6. Just give me a moment. It is vitamin B6. This deficiency is causing killosis. There could be other vitamins as well, vitamin B2, vitamin B12, etc. So vitamin B2 can also cause this disease. Vitamin D causes osteomalacia, their deficiency, absolutely correct. Osteomalacia, what happens here? The body can't process due to deficiency of vitamin D. The body can't process calcium and phosphorus. And see, this calcium and phosphorus are the main, they are the main salt of bones, right? They're the main salt, inorganic component of your bone matrix. And if they are absent, then the bone would become softening, right? So bone softening happens. The bone can't harden, bone softening. And as a result of which, the bone cannot take much of your body weight and start bending. That's why we see the children who suffer from this particular disorder, that is osteomalacia, deficiency of vitamin D. They have this bent legs, the bent hands, especially the legs are bent because the legs are bearing our entire weight, isn't it? Moving on to the next question. Good job. Who has answered correctly? Knight. Yes, it is D, beta. You are absolutely correct. Question number 20. Let's see here. Which of the following statement is incorrect regarding acute disease? Acute disease. This question was asked in the year 2020 to 2021. And acute means something that is short term. Okay, something that is short term. Something that is severe. And it can be treated with the proper treatment, with proper medication. All right. So they last for a long time. No, they don't. Wrong. A person suffering from, so we already found the answer. They are saying which is incorrect. The first one is incorrect, right? They are not for long time, short term. All right. So a person suffering from acute disease always recovers completely after treatment. Yes. Absolutely right. If the proper treatment is given, if the right treatment is given, if it is detected early, of course short term, so of course early, they do not cause long term or bad effects on human health. Yes, most of the time they don't. They are for short term. Followed by, if you see here, in this include diarrhea, malaria, etc. Absolutely right. Diarrhea, malaria, these are short term acute diseases. We found the answer, option number A. Now moving to question number 21. Knight has answered correctly for question number 20. Good job, beta. Moving on to question number 21. Select the incorrect statement regarding the given organism. So here, all the organisms that are provided here, A suggests number 1 is nothing but cycon. It is a porifer. Number 2 is a physalia. Physalia is a nidaria. It is a nidaria. 3 is a prawn. Okay, it's a prawn. That means it's an arthropoda. It is an aquatic arthropoda called as crustacea. Followed by 4. 4 is an octopus. Of course, it is also a mollusk. This is a mollusk. Okay, mollusca. Then followed by 5. This is a sea lily. Sea lily belong to echinodermata. Sea lilies belongs to echinodermata. Echinodermata. Okay, dermata. So let's see here. Organism 1 possess choanocyte. Yes. Cycon possess choanocyte because cycon is a porifer. Absolutely correct. This is a porifer, and porifer would have choanocyte, the collar cell. Collar cell helps in digestion, capturing the food and also helping in intracellular digestion. Okay. Followed by, whereas organism 5 possess water vascular system. Yes, it is an echinodermata. Echinodermata have water vascular system. Organism 2 is diploblastic animal, whereas organism 3 is triploblastic animal. Yes, this is okay. This can't be an answer because they are asking incorrect. They are asking incorrect statement, right? So we can just say here this is correct. This is also correct. Whereas organism 3 is triploblastic. 3 is your, of course, as I just written here, everything is gone. So let me write once again. This is Physalia, this is prawn, and this is again mollusca. Mollusca is here octopus. Octopus is a mollusca. This one is an echinodermata. Echinodermata, which organism? This is a sea lily. A sea lily. Okay, so yes, this is correct. Organism 3, 4 and 5 are eucoelomate. Yes, 3, 4 and 5, these are all with true coelom, so eucoelomate. But if you talk about this organism 4 and 5 possess notochord at some stage of their life, no, none of them have notochord. They are all invertebrates, they are all non-chordates, they can't have notochord. Notochord is a special feature of only chordata, so that can't be an answer. Moving to the next PYQ, the next PYQ is read the statement. You have answered question number 20, not 21. 21, please answer everybody. Read the given statement, each with 1 or 2 blanks, and select the option correctly, fills any 4 of them. Let's see here. P causes ulcer in stomach and duodenum. So P is going to be Helicobacter pylori. Helicobacter pylori is again transmitted to your body from contaminated food and water, especially rainwater and all has a huge amount of Helicobacter pylori. So if there is contamination, this particular bacterium would enter your body and can cause what? The stomach and duodenum ulcer. So P is Helicobacter pylori. There is only one option with Helicobacter pylori, so that would be the answer. But still, let's read. Q disease lasts for only short period of time but are severe. Yes, it is acute. R is caused by hypersecretion of thyroid, so that is goiter. So R is goiter, so this one here is goiter, and S is caused by hyposecretion. So S is myxedema. Myxedema. So in this option, myxedema is given. So that would be the answer. T, they are saying that dengue fever causing microbes are transmitted through bite of infected, what? Infected Aedes mosquito. So T is Aedes mosquito. Absolutely correct. Whereas sleeping sickness cause microbes are transmitted through the bite of infected testis fly. Testis fly. Okay, not sandfly. Sandfly would cause kala azar. Testis fly would cause sleeping sickness, trypanosomiasis. Okay, moving on to the next question. Given below is the diagrammatic representation of a type of animal tissue, that is X. So this is the tissue X, and we are supposed to find out what is the correct statement regarding that tissue. So they have given that it is a dense connective tissue. Absolutely wrong. You can see that there are more matrix and less fiber. So if there are less fiber, it can't be dense. It is supposed to be a loose connective tissue. So it is a loose connective tissue. It is a loose connective tissue. Absolutely right. But let's see, that act as a packaging and supporting tissue between the organs lying in the body. Absolutely right. We are talking about areolar connective tissue. Areolar connective tissue. Why not this? Because this suggests that it connects skeletal muscle to bones. That would be the job of tendon, and tendons are a part of dense connective tissue. They are not loose connective tissue. So this can't be an answer. So option number B would be the right answer. Yes, 23, option number B is absolutely correct. Good job. Moving on to the next question now. Refer to the given box containing names of some human diseases and select the incorrect statement. So let's read it out here. They are saying that diphtheria, tetanus. Okay, let's find it out. Diphtheria is bacterial. Tetanus is bacterial. Malaria is caused by a protozoa. So this is protozoal. Addison's disease is due to, again, hyposecretion of what? The adrenal cortex hormone, right? Anthrax is again bacterial. Anthrax is again bacterial. Sleeping sickness is a protozoan disease. Sleeping sickness is a protozoan disease. Poliomyelitis is a viral disease. Viral disease. Kala azar is also a type of protozoan disease. This is also a protozoan disease. Okay, so let me just correct it here. Let me write with a different color. Kala azar is a protozoan disease. Why can't I write in this page? What has happened? So this is a protozoan disease, a protozoan disease, a protozoan disease. Okay, hepatitis B is a viral disease. This is a viral disease. And cretinism is again due to hyposecretion. Due to hyposecretion of what? Cretinism is due to hyposecretion of the thyroid hormone. If a mother is pregnant and she is suffering from hyposecretion of thyroid hormone, then the baby born is born with cretinism. So let's see here. The given box contains 2 protozoan disease. No, it has 3 protozoans, so this is wrong. Disease 4, so this is absolutely wrong. Out of the 2 hormonal disorders, so yes, there are 2 hormonal disorder in the given box. One occurs due to hypersecretion of thyroid hormone. No, none of them are due to hypersecretion of the thyroid hormone. This is due to hyposecretion. So this is also wrong. C says the given box contains 2 viral diseases. Yes, it has 2 viral diseases, poliomyelitis and hepatitis B, and 3 bacterial diseases. Yes, diphtheria, tetanus and anthrax. So this is correct, but they are asking you to find out the incorrect one. So both A and B are incorrect. So option number D is going to be the right answer. Yes, both A and B is correct. Incorrect. Your right answer is D. Good job, Knight. Moving on to question number 25. Read the given passage. In this passage, they have given Charulata contracted chickenpox few days back and soon recovered from the infection. So because she has contracted chickenpox, that means she has acquired this disease and she has produced antibodies. So she is showing active immunity, natural active immunity, because her body has participated in formation of antibodies. So active immunity. Followed by she got immune to any subsequent infection of chickenpox virus. So anytime if she is going to suffer from, or going to not suffer but encounter a chickenpox virus, she is not going to suffer from it, because she has produced antibodies, she has memory cell from the previous encounter, the first encounter. So she will not be suffering from chickenpox anymore. Okay. Now, her younger brother Ajit is just 2 months old and is mother fed. He has his mother milk fed. It would be again mother milk fed. Okay, is fed with the mother milk. He has received some immunity from his mother via milk. That means we are talking about passive immunity here. So Ajit has passive immunity. So based on these 2 observations, we are supposed to find out which of the following is correct regarding Charulata and Ajit's immunity. Charulata's immune system has developed its own antibody. Yes, active immunity when encountered the pathogen or the antigen. However, Ajit has received preformed antibodies, that means passive immunity, from his mother. So this is absolutely correct. Okay, so this is going to be the right answer. Ajit's immunity is not long lasting. If it is a passive immunity, it is short lasting. It is preformed antibody. Your body hasn't participated in formation of antibodies. You have taken preformed antibodies from the mother. Right, so it is not long lasting. Then Charulata is also immune to disease like measles, polio. No, she is only immune to disease that is chickenpox. The antibodies are specific to that antigen, chickenpox, not to polio, not to measles, etc. So this can't be right. Ajit's immunity may cause some side effect. No, preformed antibodies taken from the mother through milk won't cause any side effect at all in this case. So this is also wrong. We have found the answer option number A. 25 option number A is correct. Moving on to the next question. Pulse polio immunization program was launched with an aim to eradicate polio disease. Yes, it involves simultaneous administration of polio drops, polio vaccine, to the high risk population on a single day throughout the nation. So mostly in certain countries such as India, such as Africa, such as these tropical countries, they have the they're more susceptible to contracting polio. Polio is an enterovirus, first of all. It is transmitted to your body from fecal-oral route. That means through contaminated food and water to your body. So these tropical countries, or the second world or third world countries, are more susceptible to polio. So this polio drops, which is nothing but oral polio vaccine, is given to that country. What is the basic objective to it? To immunize those children who are not earlier immunized or partially immunized. Yes, for the first time, if the child has never been immunized, it should be given to that child. That is one of the objective, correct? To boost the immunity of children already immunized. Yes, that is why you have to keep on taking it multiple times, called as booster doses. Booster doses supposed to be given to you. Then to eradicate the polio causing virus from the world. Yes, that is also another objective. So all of them are correct. All of them are correct. All these are correct. Moving on to the next question. Identify the types of epithelial tissue from given statement and select the correct option regarding them. Let's see here what they are asking us. 1. L forms a delicate thin lining of the blood vessel. That means they are talking about squamous epithelium. Squamous epithelium. Number 2. M is found in salivary and sweat gland. Okay, so they are talking about cuboidal here. Cuboidal. N forms the lining of stomach and gallbladder, so that would be columnar. Columnar. Okay, followed by O lines fallopian tube and nephrons of the kidney. So fallopian tube and nephrons of the kidney here. O is going to be again, we can talk about it as columnar, ciliated. So this is going to be ciliated. Ciliated here. So L could be cuboidal. L is not cuboidal. Wrong. M could be cuboidal. M is cuboidal. Yes. Whereas N could be columnar. N is columnar. Yes. So B is absolutely correct. Option number B matches the option. Okay. Then N could be squamous. No, N is columnar. Whereas O could be cuboidal. No, O is not cuboidal. L could be columnar. L is not columnar. It is squamous. So all of them are incorrect except B. B is right. So 27, option number B is correct, not C. Alright. Moving on to the next question. Which of the following statement is correct regarding chronic disease? So they last for a long time. Yes. Maybe as much as a lifetime. Yes, that's why chronic disease. This is correct. This is absolutely correct. A person suffering from chronic disease always recover from it completely? No. If they recover from it completely, how can it be lifetime? Chronic diseases, people may not recover from it, such as Alzheimer is one of the example of your, chronic disease. Cancer can also be chronic disease. Okay. AIDS can also be a chronic disease. Okay. So this is wrong. They do not cause, so this one is wrong. This thing is wrong. They do not cause long-term bad effect on the health. No, they do cause long-term effect. These include Alzheimer. Yes. These include cholera. No, cholera is an acute disease. Cholera is an acute disease. Okay. Arthritis. Yes. Cancer. Yes, but not cholera. That's why this is wrong. So option A is correct for question number 28. Moving on to question number 29. Refer to the given dichotomous key and select the incorrect option regarding it. So let's try to find it out. They are asking, disease is present since birth. That means they are talking about something that is congenital. Something that is congenital or present since birth. So present since birth, cleft palate, yes. Rhinitis, no. Down syndrome, yes. Kala azar, no. So we have to check A and C. Disease develops after birth. Go to 2. It is a common communicable type of disease. So communicable type of disease could be elephantiasis. Yes, elephantiasis is a communicable disease, can be passed from an infected person to a healthy person due to bite of Culex mosquito. That is correct. It could also be measles. Yes, measles is also communicable disease. Then they are asking communicable disease. Go to 3. Go to 3. This is 3. It spreads through direct contact. So see, measles can spread through direct contact, not elephantiasis. Measles can spread through direct contact from one person to other person through direct touch, through aerosol infection, through droplet infection, etc. Okay, so we have already found our answer. C is going to be the right answer, but still let's read it out here. R could be malaria. It is spread through vector. Yes, malaria is spreading through vector, and that vector is nothing but the female Anopheles mosquito. female Anopheles mosquito? So we have already found the answer here. Moving on to the last question for today, because this is a marathon and I'm going to bring more and more questions for you from Olympiad PYQs and some most expected questions of the Olympiad examinations. Refer to the given figure of blood vessel, identify X, Y and V. So here you look at X. X is an artery. It's an artery because you can see that their lumen is narrow. Lumen is narrow because there is high blood pressure. Due to that, the blood pressure increases because of narrow lumen. The tunica media is very thick. Thick wall in the artery makes the lumen narrow and increases the blood pressure there. Z here is a vein, and why it is a vein? You can see the presence of valve, right? And the lumen is wider. The lumen is wider. Lumen wider, and that's why the BP is usually lower here than the artery. And what is Y? Y is the capillary where the diffusion of gases and nutrient occurs. So let's read it out. What they are trying to say: blood flows through X under high pressure. Yes, you have to find out the incorrect, by the way. You have to find out the incorrect. So this is correct. Y helps in exchange of substances between blood and the body cell. Yes, capillary helps in diffusion. True. Then Z have a thick elastic wall. Z do not have a thick elastic wall. Wrong. They have a very thin wall. That's why their lumen is so wider. Na? They have a very thin wall. You can see here they have a very thin wall. They have a very thin wall. X is usually deeply seated. Yes, arteries are present deep within your body. Veins are more superficial. That's why the veins are visible through your skin. What you see here, these are veins, not your artery. Arteries are deep seated. Alright, so C is going to be the right answer. These are all the questions that we had to discuss today on the Olympiad PYQs for all of you. I'll be back with more and more questions, more and more PYQs, and along with PYQs, I am also planning to bring some expected questions as well for all of you in the next marathon for all the foundation class students, those who are going to appear for Olympiad, those who are preparing for Olympiad. So stay tuned only on PrepMed Foundation channel. I'll be back with lots of exciting questions, lots of PYQs for all of you. Thank you very much. Take care of your health and stay safe, everyone.